I'm all like buzzing excited. Okay. Hi everyone, my name's Dr. Kaylee, also known as Kale's baby. And I wanted to talk to you about a little bit of a weird thing that happens in the NHS for us doctors. The time that we get bonuses is actually when you die. Let me explain. So for the new FY1 doctors coming in, this is going to really apply for you. You are primarily, I'm an FY1 doctor and I'm transitioning into F2. FY stands for foundation year. Us doctors, we are the ones who sign death certificates and cremation forms. So if you die in hospital, a doctor is responsible for signing your cremation forms as well as your death certificate. And not everyone gets cremated, but if they choose to be cremated, we have to fill out additional paperwork. So what happens is the bereavement office will email any of the doctors who were looking after that patient in the recent days and say, please see us in the bereavement office. You have to fill out paperwork that kind of explains who this patient was to you, how long they were under your care, and the journey of what brought them into hospital and caused them to die, as well as going to see the body after they die in the morgue to make sure that they don't have any devices like pacemakers, which can blow up when they're put through cremation. So this process, in doing so, we get paid £82. And it either gets brought to you as a check with the reference of the patient's name or a direct deposit, again, with the reference of the patient's name. And the amount's always the same, it's £82. And it's just a bit weird, like the only time we get paid extra is when you die. So that's kind of like your bonus weird thing. And then I want to talk about how much I actually make as a foundation year 1 doctor, because many people know in the NHS, in the UK, we are striking as junior doctors, which we're now phasing out and using the word resident doctors. The base salary of a resident year 1 doctor in the UK is £29,000 per year. And how it does is every 4 months we rotate. And when you rotate, you're going to be given a different kind of schedule of how often you're working. And we'll make money on top of that if we're working weekends or outside of the scheduled hours. So for me, I've worked 3 different placement rotations of medical on-calls. Medical on-calls mean I'm working on average, I think 48 hours a week. So some weeks I might be working 70 hours, other weeks I'm working the more typical 35 to 40 hours. And I'm working 1 in 3 weekends on that. And those weekend shifts are 13-hour days. So that is how much I'm working. And when it comes to after taxes and after NHS pension and with the London bonus, I'm getting paid £2,400 per month. So that's how much I make each month on my current schedule of 1 in 3 weekends and being based in the outer London waiting. That's not including any loans. So if you are paying student loans, you'll make even less than that. So for me in London, I'm spending £1,100 on rent and bills. So before anything happens, I have about 1,200-ish to work with for the rest of my month. And this £82 is actually very helpful. So everyone else they can choose what they'd like to do with their £82. I have some colleagues who donate to charity. I have others who do a little more eccentric things like buying shoes for every time they fill out the paperwork and naming the shoe after that patient. Myself, it helps make ends meet. It's very twisted that my bonuses are when people die. In the current, I guess, weather of the NHS and being a junior doctor, it's what's helping me kind of keep up month to month. So that is a weird tip and insight on what it's like as a first year resident doctor in the NHS. And next time people ask, why are you striking? You can show them this video and say, it's very, very hard to get by with the current salary. So yeah, thanks for watching, and leave a comment if you have any questions.